Hello there, sir. My name is Dr. Gordon Kevin Cooper. Okay. I'm one of the doctors working in the neurology department. Can I just confirm your name and date of birth, please?
My name's it's Kevin O'Loughlin. It's 28th of September 1979.
Okay. So I've got some results to give you, okay, based on your scans, and what they show is essentially evidence that you've got a MS, which is, so that it stands for multiple sclerosis.
Right.
Yeah.
Sorry. Hang on a minute. So I've just I just went for a scan 2 months ago or a month ago.
Yep.
I just had a problem with my eyes. I went to the GP. They say to go to the scan. Got a letter saying obviously bring a family member. So
yeah. So I can see from the MRI results. So the MRI was done 2 weeks ago. So
yep.
2 weeks ago you were in to get this scan, and the doctor say to you that they were thinking it was MS. Is that
no?
No, just come as a shock then, I take it.
Well, when I got the letter, it said to come and come to meet face to face. I did phone up and ask, and they said it's better for you to meet face to face.
And is your doctor? Sorry, is your wife here just now, or?
Well, yeah, she's out in the car, but I just said I wanted to come in just to speak to yourself.
Well, I'll tell you what I'll say to you. Basically, it's a what they call it. It's an autoimmune disease, okay, and basically you get inflammation around the myelin sheath that coats the nerve cells, okay. So essentially you can get symptoms in your eyes, you can get symptoms elsewhere in the body, okay. A lot of the time we can treat them, but you're left with some disability in these types of nerves, okay. There's no real cure or anything like that, although there is some good treatments, okay, we can try and consider putting you on. What else? So, sorry, do you have any past medical history? Do you have any drug allergies? Do you have any drug allergies?
No, I've been totally fine. No drug allergies. My health's been great until my eyesight went. So what does this mean?
So essentially, like I said before, so it's to do with the myelin sheath. So it's an autoimmune disease. So that means basically your body fights itself. Okay, it attacks itself, and like I say, it can happen elsewhere. So you might end up incontinent eventually. It might be that you're not able to walk or anything like that eventually as well. So it's important that we get you on the right treatments as soon as we can, really, for it. Okay. So
sorry, you're saying I only want to walk?
So not necessarily. So some people might have some difficulty with walking eventually further down the line if you've got relapsing or remitting MS versus primary progressive or secondary progressive MS. So it really depends on what kind of form that you've got, and I don't really know which one that you have. But it's, there is some good things that you can get in your house to help you out and about. So there's good advances in wheelchairs and things like that nowadays, as well as we can get carers in and stuff to try and help out. So again, we tend to treat you as a whole, okay, when you come in and you have these types of diagnoses. Sorry, do you have any questions? Any questions about that?
Yeah, sorry, taking it back a little bit. I don't understand. So you're saying I've got MS, is that right? Is that correct?
Yeah, yep, you've got MS.
Right.
It looks like that. From what I can see in the scan, it looks like you probably got MS.
Okay. I don't know a lot about MS. No family history of MS in terms of my auntie, uncles, mum, dad, other than my wife's side. I only know anything about MS. It's just really been on the just through news or what have you. I've just seen the more severe side of it. I'm a bit concerned. I've obviously got 2 young kids. I've got a job.
Oh, right.
How's this going to affect me going forward?
Okay.
You know,
Right. So would you work as, sorry?
I work as a plumber, so I just want to know.
Right, okay. So you work as a plumber. So you might have some, like I say, you might get some damage to the nerves in your hands and stuff like that, kind of eventually. So it might be that you might not be able to do some of the manual stuff. You might need to maybe take a step back and do some typing or something like that at some point further down the line. Okay, so sometimes, like I say, it can affect people's jobs if they're doing things with their hands a lot of the time. Okay. For example, I had another patient, okay, who is similar to yourself, and he was a runner, okay, and it turns out he couldn't do much running anymore, so he went into coaching instead. So there's some, like I say, try and find ways around about it. Okay. I do actually. I've only got a couple of minutes left, so can I ask you a couple other questions? Is that okay? Do you have any family history of rheumatoid arthritis
Sorry, I just need to get a minute.
or asthma?
I don't think so.
Okay. And you said you've no allergies. Do you take any regular medications?
No.
No. And do you drink a lot?
Moderately.
Moderately. And what about smoking? Are you a smoker?
No.
No. Okay. I think that's me done. Then, so any other questions before I go?
Yeah. What happens in regards to just how do I see now?
So what probably will happen is I'll send you out an appointment to speak to the consultant, and then you can have a chat with them about your MS and what we're gonna.
Can I back up here for a second?
Uh-huh.
I've obviously got responsibilities in my everyday life. I've been given this diagnosis. I need to inform certain people in my life in terms of work, all the above. Who do I go to from here? What do I see?
So what I'll do is I'll give you a pamphlet, and you can kind of hand that around as well. And like I say, you'll see the consultant in a couple of weeks' time. So you know, from me, I can just tell you that it looks like you've got MS on your scan, and the consultant will maybe take your treatment ahead after that. So I can't really tell you any other information, but other than that, but that's the main thing you need to know. Okay.
So I'll get the pamphlet.
Yeah, so I'll give you a pamphlet. I'll give you, and what I'll get to. I'll get one of the nurses to arrange your appointment, and they'll try and make it urgent so that you can speak to him. That essentially we need to know whether to stick you on corticosteroids just now versus to give you one of the other types of treatments. So going ahead from that, probably he's the one to make that kind of choice, you know, before they stick you on, and then you'll be treated with a nurse afterwards for the time being.
And so anything you can, so I don't, in terms of MS, I don't know anything about it. Is there anything you can tell me at this present moment? Is this, how debilitating will this be for me? Like, I've got 2 young kids. Just in terms of that, I need to kind of.
I've already kind of explained what the disease is. Do you know what I mean? I've explained how it attacks the nerves and the myelin sheath surrounding the neurons. Okay, but like I say, I can't really, as I said before, I can't give you any answers as to how it's going to affect your personal life. Okay, I can't tell you.
So, I don't understand what that means. I guess in terms of, if you talk to me about in layman terms, like will I be able to see? How's it going to affect in terms of that?
Well, basically, it could be that the nerves don't work as well anymore. Like I say, after that, they have these attacks. So you get these attacks where your body kind of attacks various nerves in your body. Okay, and these nerves have got functions like moving and keeping your bladder in check and your eyes in check and stuff like that. So when you get issues with them, then you know that's due to the MS. It can cause these flare-ups, what they call them, flares. Okay, it's flares of the nerves. That's what it is.
Whereas, okay, so is it serious or not serious?
I would say it's serious. I would say it's serious. You know, going ahead, there's no cure for it. It's one of these things, but like I say, we'll do our best, get you some treatments, get you on the right stuff, and you should be right as rain after that. Okay. Once we get you in the right stuff, you'll be golden.
And I'll be able to continue a normal life if you the treatment.
Well, you know, like I say, I never said that. But once we get you on the treatment, like I say, you'll be better.
Okay.
But I can't tell you. You need to speak to the consultant. He'll be able to tell you.
So I'm going to speak to the consultant.
Aye.
Right. Okay. I'm a bit. My head's everywhere. With this information. When do I get a chance to speak to the consultant?
So I'll give you a wee appointment.
Right.
And let's say within 2 weeks, I'll make it urgent. I'll get the nurse to do it, so she knows how to make it urgent. Once she does that, then it'll be fine.
If I put a contact, can I contact to speak to someone about this? And my head's racing. If I go home, can I speak to someone as a person?
Well, I'll give you the leaflet, mate. So
Uh-huh.
you read through the leaflet, and then, like I say, you'll see the consultant in a bit, and he'll give you the answers in 2 weeks.
So when I leave here, am I getting medication straight away? Am I getting medication down the line? When am I getting medication for it? Or what's the deal?
I'm not too sure. I think the consultant probably maybe be able to answer whether we should give you something or not. I think. So, I'll have a chat with this afterwards with the consultant. I'll see if he wants me to stick you on something just now. How's that? And then I can give you a phone. Does that sound? And then that's you getting treated even quicker.
Yeah.
How does that sound?
Sorry, I'm just a bit. My head's blown a little bit here.
Well, I'm actually going to have to leave just now. But if you, like I say, I'll just say to the clinic coordinator, I'd give you a wee 10 minutes to kind of sort yourself out before you leave. Okay. And if you have any questions, like I say, I'll be in the next room. I'll be seeing a patient, but you know, afterwards when I'm done, you can come back in. And how does that grab you?
Yeah, that's fine. Okay,
Right.
I'll get my thoughts together and think
Magic.
about it.
Okay, that's fine then. I'll see you later.